I think your Quervains that you are having postpartum is more of because of the hormone fluctuations in the estrogen receptor beta expression, which is overexpressing itself, is causing your Quervain's disease, which is a tenosynovitis surrounding the sheath of the first tunnel. I don't think it's just mechanical what you're doing. I think it is the hormone fluctuation causing a change at the tendon. And in this article, stenosing tenosynovitis of the first dorsal compartment of the wrist is common, but how is estrogen involved is still unknown. We previously reported that inflammation was involved in the pathogenesis of this ailment. In the present study, we extend our investigation of estrogen receptor beta expression to determine whether estrogen is involved in the pathogenesis of Quervains. And they found that the estrogen receptor beta expression in the retinaculum was positively associated with the disease grade and patient age, and the disease severity was associated with inflammatory factors like the interleukins and COX-2. And if you saw this, you would know that it's not that you did anything wrong, and it is not associated with your heavy baby, but I think that there is a chemical and genetic piece to this. Other studies show that there are variant slips that cause an increased septum, and anytime that there is an increased connective tissue, there is a likelihood that irritation can happen. I also am curious if it has to do with EDS. If you have a connective tissue like EDS, you already have haphazard collagen, then add in the hormones of postpartum, which, by the way, if you're still breastfeeding, you're very flexible, because Quervains has been noted, if you have it while you're postpartum, to resume when you stop breastfeeding. So the moment you stop breastfeeding, the last breastfeeding, 6 weeks from that, I think you resume more of a normal connective tissue, tendinous version of yourself. And so I say to you, hormones matter, and your tendons don't like hormone fluctuations. Now, in this particular situation, you can't stop being postpartum. You are thankful that you've made it this far. You're also probably not going to stop breastfeeding because you're thankful that you made it this far. So what can you do? Because you're stretched past what you can. In my patients, I work on strengthening. I work on strengthening of the upper back. I work on posturing. I work on using something to support your child while you're breastfeeding. We sometimes even have patients sleep with splints to put them in a neutral position to not further aggravate if they're sleeping curled in. And these are the things that we do to help them while we wait for normal healing to happen. And then someday, when they stop breastfeeding, it miraculously goes away. An overserved estrogen receptor beta strikes again. It hits women when they're in the postpartum. It hits women when they're in perimenopause and menopause. Estrogen doesn't play around at all. And really, I should say the estrogen receptor beta. It's a real pill. It's like your drunk friend that won't go home.